Hello, good evening, good afternoon, good morning, depending from where you are watching us from. This is me, Engineer Sonny Bamnafor, your safety coach. We've come again to look at some important safety topics. Today, we're looking at chemical safety toolbox talk. Most people might just say, I'm not working in a chemical company. But in their backyard, they are producing soap. They are producing one thing or the other that has to do with chemicals. It mustn't be in a bigger company. Anywhere you are and you are dealing with anything that has to do with chemicals, you are using them or you are producing them. You use all these things, even in your houses. Bring your chair, sit down, let us talk. Let me remind you of one or two things. Now, when you are talking about chemical safety, the first thing you will look at, so far you are using it, is the PPE, personal protective equipment. Wear your personal protective equipment. You have to check the resistance level. If it's something that you need to use to cover your nose, use the proper one. Check it. Check the body of the chemical. There are PPE that are required for you to use. Use it. Also, in the body of the chemical, do you check the label? Do you read the label? You need to read it and understand how to use it. Then avoid mixing a lot of chemicals together. Some chemicals are endothermic, some are inothermic, some can explode if you mix them without care. Then the second one is handle and store safely. How do you do that? Keep areas clean. Keep them away from fire, flame, or anything that can cause explosion. Use a ventilated area so that you don't kill yourself. Then always do what? Wash your hand. Immediately you finish using a chemical, wash your hand properly with soap. Then you need to understand the hazard. That's number 3. The hazard, meaning that you have to read your safety data sheet, SDS. If you don't read it, you will kill yourself if you don't take time. Then recognize the hazard symbols. If you see some symbol, they draw someone like head, skull and bone. They draw something that can shock. They draw some radiation. Read it and understand those symbols. Then number 5, spill response. What are the response do you do? Immediately it spill over. Alert and contain. Alert people and then look for something to contain it. Clean it up properly so that the odor, someone will not inhale it and have another sickness. Then what again? The 6th one, best practices. Try your best to do it the best way. Not just because they are doing it, let me do it. The best way matters a lot. Keep area clean. Use a ventilated area. If you are using it, if you are doing it in your house, make sure the home windows are open. If you are doing it in a warehouse, open up everywhere. In the workshop, let there be ventilation so that there will be enough oxygen. And as I said before, immediately you finish, wash your hand. Remember that there are emergency procedure that you have to look into if something like that happen. If the skin exposure, there are emergency procedure. That's why we talk about eye wash station and shower. If it touches your skin, wash it. If you don't have all those things, go inside your bedroom and make sure you wash it. Flush it. Let the water flush your eye. Don't put soap. Don't put any other thing. Just open your eye and flush with water. And also make sure you cover your nose to avoid inhalation. And if you do all these things, please don't just say, I have taken one treatment or the other. You need to see your doctor. Rinse your face and see your doctor. Do not try to vomit because it's trying to make you somehow you want to vomit it out. No, don't do it. Always walk safe for your future because you have to avoid chronic disease and acute disease. Acute disease is the one that just happen immediately. Chronic will stay in your body for a very long time, and maybe when you are retired, it will manifest. Always follow toolbox talk when dealing with chemical. Chemical safety, very important. Do it to save life. Thank you and God bless you.